There are a lot of good reasons to have your wisdom teeth removed. First and foremost, pain. Pain is a precursor to infection, and nobody wants to be in pain. So if I see a tooth that's coming through the gum tissue and it's causing pain, clear indication, let's remove it. Another reason for taking out wisdom teeth, even if they're not hurting, is gum disease. And so there was a study done at the University of North Carolina several years ago. And what this study showed was in people who have an impacted or a retained wisdom tooth, more than 40% of those patients will have a pocket, a gum disease pocket. And those pockets are areas that we can't keep clean. It would require a hygienist going in and cleaning them at least once a week, and nobody really wants to have to go through that. So 40% or more of people with impacted wisdom teeth will develop gum disease that can then spread forward to the teeth in front of it, and we don't want to have to lose more teeth than our wisdom teeth. Another reason to consider having your wisdom teeth taken out, you are actually 2.8 times more likely to fracture your jaw due to the presence of an impacted wisdom tooth. Now, that could be playing football, it could be getting in a car wreck, but you're on average 2.8 times more likely to have a broken jaw due to the wisdom tooth. They also did another study that looked at a cost analysis of having your wisdom teeth taken out when you were a teenager versus as a 30-year-old. And they looked at the price of having teeth taken out at the age of 18, and they compared that to the cost of having your wisdom teeth monitored annually, which you should do if you don't have them taken out, and then having to have just one of those teeth removed at the age of 30. And what they found was, when you take into account the cost of all your dental appointments, the x-rays, the monitoring, and then the loss of income, certainly at the age of 30, because most of us aren't making a ton of income when we're 18, it was significantly cheaper to have your wisdom teeth taken out at the age of 18 as compared to waiting later in life. Another reason to consider having your wisdom teeth taken out is that an impacted wisdom tooth that's not causing you any pain can go unmonitored for a long period of time. And when that happens, you can develop a cyst or a tumor associated with that tooth. And when those teeth are unmonitored, that cyst can grow to a significant size where we have to go in and remove it, and that creates a very large hole, a defect, and it's a very uncomfortable, unpleasant, and morbid procedure. So it's much better if we can monitor you early, figure out what's going on early, and get it addressed in an appropriate time frame.